This is QD Clinic. I'm Jack Cush with RoomNow.com. QD Clinic is brought to you by RoomNow Live. You can register at RoomNow.live. It's coming up in less than 2 weeks. Today's episode is me being anti-intraarticular. So, since the onset of COVID, all kinds of precautions came into play. Practice changed. A lot of things changed. We were forbidden from doing intraarticular injections electively for many, many months, probably even almost a whole year. And now I guess we're back to doing them. Some rheumatologists do a lot of intraarticular injections. I have always done a moderate amount. I'm really good at it, so my patients say. But if you look at Room Now and look up the word intraarticular, see there's been a lot of reports over the years about the lack of true efficacy with intraarticular injection. And with not doing any intraarticular injections in almost a year, I've come to realize I really don't need these to manage patients effectively. Intraarticular injections are great temporizing measures, but their long-term benefit is basically zilch. Their long-term hazards are real but small. So what's the evidence? In 2017, JAMA does a meta-analysis of 27 trials, 1,767 patients. They show that for one patient to benefit from an intraarticular injection as opposed to a placebo, the NNT is 8, meaning you have to do 8 injections for one to truly benefit. That's not very good. It certainly doesn't meet my expectations. Clearly, there's a modest or moderate benefit in the first 2 weeks post-injection, but after 2 weeks, at 3 months, 6 months, and even after, none. No benefit at all. In their study, they showed really no side effects of intraarticular injections, but that was not the case with other studies. Recently, the Journal of Rheumatology in January 2021 did another meta-analysis of intraarticular injections for knee OA, showing it was no better than placebo. So analysis of 6 trials showed that, again, exactly the same. They looked at 14 randomized control trials, 2 observational trials that basically showed no clinical benefit. And of course, there's always some 1-2 week benefit, but really that there are other endpoints of 3 and 6 months, no clinical benefit, but they did show significantly more risk for cartilage loss, and I think that was an odds ratio or hazard ratio of about 3, and a higher risk of joint replacement of 2.5, suggesting that maybe you're doing injections in patients who are end stage and are going to progress to joint replacement anyway. But it could be that you're injecting the joint and allowing the patient to pound on the joint. Are you not contributing to rapid progression of cartilage loss? Again, this is a supposition, but clearly there's no real benefit, but there is a downside. More importantly, other studies have shown that if you're doing joint injections within 3 or 6 months of the need for joint replacement, and this has been shown for both hips and knees, that there's a higher rate of poorer outcomes, including postoperative infection, the need for revision surgery, etc. So while the American Academy of Orthopedics doesn't have a view on this, and while the ACR and the Osteoarthritis Research Society do have the view that there's some benefit to intraarticular injection, I think it's important to note the limitations. And again, can you live without it? Can the patient live without it? I do think intraarticular injections are good temporizing measures. This comes up because I saw a patient just the other day who I haven't seen in 6 months, and she came in walking like she just got shot in the leg. But her story was she had a flare of her osteoarthritis in her knees. It was swollen. It wasn't warm, but it was really painful. Now, she could have torn a meniscus. She's got a new effusion there. It's something I can do to make her better this week, but then you need a plan for the long-term relief, whether that's referring them to the orthopedist or doing an MR or changing up their medical therapy. Weight loss always works, but seldom done. So again, I'm relying less and less on intraarticular injections. I don't know about you. I'd love to hear from you. You can actually tell me what you think on Backtalk. That's something you can click on my website or on the email and leave a message for me, and we'll discuss it in our weekly podcast. Tune in for more QD Clinics.